Good morning, welcome to Happy Toe Tuesdays. My name is Martia Hopfleisch and I'm a nurse that specializes in foot care. Today I am talking about neurological disorders, and usually there's three nervous systems that's affected, either your sensory impairment, motor impairment, or autonomic impairment. And the sensory impairment is where a lot of diabetics usually have it, but that you don't have to be a diabetic, is where your nerves don't conduct messages anymore. So you have a numb feeling in your feet. If somebody touches or vibration or pain, you don't feel that in your nerves anymore and in your feet. So that's sensory impairment. Then you get motor impairment, where there's weakness or paralysis and disformity of tendons and bones, and you have involuntary movements, weaknesses and contractures that form. Sometimes because of patients that lies in bed a long time or they don't use their limbs, it becomes disformed, and it's a physical thing, motor impairment. And then you get autonomic impairment. It's mostly to do with the skin, where the reaction is not as good as it used to be. So your skin could be very dry, or your veins don't constrict as easily as they used to. So that affects your circulation. So you can end up having a very dry skin. So the most important thing is to look at what the patient's needs are. If they can't feel anything, you have to teach them. If you can't feel it, you have to use your eyes to look and see what's going on, because you know you cannot feel. And if you have somebody that can't feel, that they bump their toe or they cut their feet, and it's not treated soon enough, it can lead to amputations. You don't want to hear about that. So it's important to help them realize that they have a problem, so that they can take the necessary steps to manage the problem. So that means, from diabetics, I will tell them we'll test their feeling with a little monofilament, and to see if their sensory impairment has happened or not, and then decide, okay, well, you don't have great feeling in your feet, what are you going to do about it? So I give them certain times of the day that they have to check their feet, maybe when they take their pills, or if they walk barefoot, which is not recommended, but if you walk barefoot and you go through the door, I always say you have to check your feet every time you go through the door to make sure that they're intact. Or even have somebody that checks your feet every day. You know, good morning, how does my feet look today? And then off you go. And that just makes it easier to manage and put it in your day. Motor impairment would be more how your foot is positioned in the shoe. Maybe you have callus at the top or at the bottom. So just to manage that it's that it doesn't make big callus that ends up being ulcers and problems, blistering. So also to get insoles so that it aligns your toes better if it's still something that you can look at. Sometimes I always say the clock is struck 12 and then it's too late. Then you might need surgery or have to invest in better shoes so that it'll accommodate the new shape of your foot. A little bit of deformity there. And then autonomic impairment, where you have dry skin, is just to make sure that the skin stays intact. Now, skin is an amazing organ. It keeps everything on the inside. And if you have broken skin, it creates so many problems with risk of infection, and one thing leading to another. I know my husband always says is a bunch of little things that happen one after the other that leads to bigger problems. So just to make sure that you keep your skin intact, it's a very easy way to keep away from harm. So yes, so that's it for neurological disorders. You can leave me your comments and questions below, and I hope you have a wonderful Tuesday.